The way Castro responded surprised Washington, several U.S. officials familiar with the exchange told the Associated Press. In a rare face-to-face conversation, Castro told U.S. diplomat Jeffrey De Laurentiis that he was equally baffled and concerned. Predictably, Castro denied any responsibility. But U.S. officials were caught off guard by the way he addressed the matter, devoid of the indignant, "How dare you accuse us" attitude the U.S. had come to expect from Cuba's leaders. The Cubans even offered to let the FBI come down to Havana to investigate. Though cooperation has improved recently, there was a joint law enforcement dialogue Friday in Washington. This level of access was extraordinary. Some countries don't want any more FBI agents in their country than they have to, and that number could be zero, said Leo Taddeo, a retired FBI supervisor who served abroad. Cuba is in that group. The list of confirmed American victims was much shorter on February 17, when the U.S. first complained to Cuba. Today, the number of medically confirmed cases stands at 21, plus several Canadians. Some Americans have permanent hearing loss or mild brain injury. The developments have frightened Havana's tight-knit diplomatic community. But several U.S. officials say there are real reasons to question whether Cuba perpetrated a clandestine campaign of aggression. The officials weren't authorized to discuss the ongoing investigation and demanded anonymity. When the U.S. has accused Cuba in the past of misbehavior, such as harassing diplomats or cracking down on local dissidents, Havana has often accused Washington of making it up. This time, although Castro denied involvement, his government didn't dispute that something troubling may have gone down on Cuban soil. Nevertheless, anger is rising in Washington. On Friday, 5 Republican senators wrote to Secretary of State Rex Tillerson, urging him to kick all Cuban diplomats out of the United States and close America's newly re-established embassy in Havana. Cuba's neglect of its duty to protect our diplomats and their families cannot go unchallenged, said the lawmakers, who included Senator Marco Rubio of Florida, a prominent Cuban American, and the number 2 Senate Republican, John Cornyn of Texas. For decades, Cuba and the U.S. harassed each other's diplomats. The Cubans might break into homes to rearrange furniture or leave feces unflushed in a toilet. The Americans might conduct obvious break-ins and traffic stops, puncture tires or break headlights. Yet those pranks were primarily to pester, not to harm. What U.S. diplomats started reporting last November was altogether different. As America awaited an unpredictable new administration, Cuba faced a pivotal moment, too. Fidel Castro died on November 25. The revolutionary had reigned for nearly a half-century before ceding power to his brother, Raul, in his ailing last years. It was no secret in Cuba that Fidel, along with some supporters in the government, were uneasy about Raul Castro's opening with the U.S. There is a struggle going on for the soul of their revolution, said Michael Parmley, who headed the U.S. diplomatic post in Havana from 2005 to 2008. It's entirely possible there are rogue elements. When the first diplomats came forward with their inexplicable episodes and symptoms, the U.S. didn't connect the dots. It took weeks before embassy officials pieced together clusters of incidents, and multiple victims with confirmed health damage. As Trump took office, a clearer picture started to emerge. On February 17, the U.S. complained to Cuba's embassy in Washington and its foreign ministry in Havana. Soon came Castro, seeking out De Laurentiis directly. The attacks halted for a time. But several U.S. officials said it wasn't clear why. It wasn't long before the incidents started again, as mysteriously as they'd stopped. Then the Canadians got hit. Between March and May, between 5 and 10 households were hit with symptoms including nausea, headaches, and nosebleeds, said a Canadian official with knowledge of his country's investigation. Then those attacks, too, ended. What culprit would want to attack both the U.S. and its northern neighbor? The Canadians tested some of their staff in Havana and recalled others home temporarily, the Canadian official said. Searching for its own answers, the U.S. Embassy conducted medical tests on staffers. Many were sent to the University of Miami for further examination. The State Department consulted with doctors at Johns Hopkins University and the University of Pennsylvania. The U.S. encouraged those institutions to keep what they knew private. In Havana's diplomatic circles, anxiety spread. The French embassy tested employees after a staff member raised health concerns, according to a French diplomat familiar with the matter. False alarm, the tests turned up no signs of damage consistent with a sonic attack. Neither country disclosed the expulsion at the time. Cuba didn't retaliate. The next month, Trump imposed some barriers to travel between the former Cold War foes. But there was no hint it was to punish Castro's government for the attacks. Trump left much of Obama's broader détente intact, including the two nations' reopened embassies. The diplomats suffered in private, until August 9. 2 weeks later, the U.S. announced at least 16 Americans showed symptoms. At that point, the State Department said the incidents were not ongoing. Still, the tally continued to rise, first to 19 victims, and then this week to 21. In the meantime, the State Department had to withdraw its assurance the attacks had long ceased. There had been another incident, on August 21. The reality is, we don't know who or what has caused this, State Department spokeswoman Heather Nauert said Thursday. And that's why the investigation is underway. Editor's note _1 in a series of stories.